Hi, everybody. Welcome back to the Global Women in Security Alliance 2020, our virtual series. My next guest, Ms. Juliane Kause. She's the Chief Medical Officer and Medical Director for the Anvil Group. Ms. Juliane, welcome to the show.
Thank you so much for inviting me. It's a great pleasure and honor to be here today.
As is for me, too. Today, we're going to talk about PTSD and PTSS in 2020. Before, let me give you a little bit of background on Juliane. She graduated from Charing Cross and Westminster Medical School in 1994 and is now an accredited specialist in acute and critical care medicine. Alongside her hospital work, academic research, and quality improvement credentials, Juliane has traveled all over the globe and enrolled as a flight doctor, conducting aeromedical retrievals and providing international medical assistance. She is now the Chief Medical Officer at the Anvil Group. Ms. Juliane, impressive background. Could you start by telling us a little bit about how your career got started and how you look back on that now?
Yeah, sure. So I went to university in London, to Charing Cross Medical School, which was opposite the British Parliament, the Houses of Commons, in the heart of London, and it closed its door in 1993. It was one of those old British institutions with wood-panelled walls, separate common rooms for seniors, juniors, men and women, the kind of world that doesn't exist anymore. And our teachers were highly experienced and mostly very wise people from a different era. We learned a huge amount of resilience and community spirit from that generation. And as doctors, we learned that we would often face difficult decisions made in a hurry, and that others would often judge us once those decisions had been made. But I also learned that one is not alone in dealing with those challenges. And it was only much later that I appreciated that the values that we were imbued with, in addition to our technical and clinical medical training.
Juliane, how did a young doctor become a specialist with such a successful international career?
So when I look back at my inner drivers at the start of my career and how I work now, there are several common themes. First, there's luck. There were many young women of my generation who did not have the opportunity to go to university, which brings me to the second theme, opportunity. When it appears in front of you, grab it and make the best of it. When I have a moment of uncertainty, I tell myself that I'm as capable as the next person. Smile, learn, and move on. So many women that I know are filled with self-doubt and an expectation of perfection. And we pass by opportunities assuming that others will be better than us. With all this luck and opportunity, a good dose of determination is needed to succeed. And I don't just mean the glorious moments of attending a graduation ceremony or getting that job or promotion or being recognized for an achievement. What has really made the difference in my life is to carry on being determined at times of disappointment and failure. That's when the greatest learning occurs, and that's when the lessons are remembered. Above all, I've had the luck and opportunity and determination to seek out mentors, and those are people who continue to support my personal and professional growth.
I'm curious how you deal with stress now. I imagine that a career in intensive care medicine and international medical assistance has put you in many stressful situations.
You're absolutely right. There have been countless stressful experiences, especially in the early part of a medical career and on aeromedical retrievals, when not only the patient's condition, but also the environment is uncontrollable. And you always wonder, could you have done something more? Could you have done something different? And often there's not. I've learned that for me, there's a lack of control over a situation that provokes a stress response. And I think this is probably true for most people. However, there came a turning point which I remember vividly. A patient was seriously ill in our intensive care unit, and I had worked all night to keep this person alive. At dawn, it was clear to me that this person would not survive, but rather than being filled with guilt, remorse, or anger, I had a moment of clear knowing that I'd done absolutely everything that was humanly possible in my profession to save this person's life. And after our morning meeting, the head of department stood next to me, and we looked at the patient from the end of the bed, and he said, "You're there, you've got it." And I knew exactly what I meant, and I was totally okay with that.
What would you say are the top 3 lessons that you've learned while dealing with COVID-19 issues for your organization?
I've learned that communication is key. It doesn't matter how often the information is repeated. The fact that our colleagues know that we are watching out for their safety at work and for their emotional well-being has a hugely reassuring effect on people. Secondly, I've learned to accept that things are different now. The world is not going to go back to 2019. No one anticipated that there would be these massive changes during 2020. So as leaders, we need to demonstrate that we are embracing change and uncertainty and that we can thrive in the discomfort this creates. Acknowledging this can be really hard at times, but has immeasurable benefits on other people in the organization as it creates a wave of we are all in this together and we're going through this together. And lastly, learning from mistakes. None of us knew what we were doing in terms of treating COVID, managing our staff, providing a service, and official guidance changed sometimes twice a day during the early days of the pandemic. The best way I have found of dealing with this is to remain calm, focused on what can be done, and there's always something that can be done, and to remain determined to do the best with all the available resources, and that includes information, and communicating this as well as possible. Some decisions, of course, would have been wrong with hindsight, but I call that learning. And this approach avoids unhealthy stress reactions.
There's been a lot of discussion in the media about PTSD, PTSS, and COVID-19. Maybe you could tell us a little bit about the difference between post-traumatic stress disorder and post-traumatic stress symptoms. I think that's a fine point that many people might not realize.
Sure, and it's really easy to confuse post-traumatic stress symptoms and post-traumatic stress disorder. So I'm really glad you asked me that question, because most of us will experience post-traumatic stress symptoms at some point in our lives. So it's important that we all understand it. And they're rather long words. So from now on, I think I'll use PTSS and PTSD. But even though they sound similar, they're absolutely not the same condition. Both are associated with a feeling of fearfulness or feeling nervous, avoiding an activity or place associated with a traumatic event. And people usually have nightmares related to the traumatic event. But there's significant differences in the intensity of symptoms that people experience, the duration of, and the effective treatments.
Can you talk a little bit more about post-traumatic stress symptoms? This is a very fine line here. I think it's very helpful for people to understand you might not have PTSD, you just might have had some symptoms on your way to PTSD.
Absolutely right. So post-traumatic stress symptoms are common, and it's a normal response to experiencing a traumatic or stressful event. For example, a car accident can trigger PTSS, as well as some more unusual events like a pandemic or kidnapping. Almost everyone who experiences a scary situation will show at least a few signs of post-traumatic stress. The symptoms we all experience at times are caused by the way the human body responds to stress. Our brains are hardwired to shut down all functions that are not essential for survival when we are faced with intense stress. Such a situation leads to release of stress hormones, for example, adrenaline. The effect of these hormones on our body is as follows. Our blood diverts to the heart and to the muscles to help us run faster and to escape danger. And this in turn makes us breathe faster. And because there's less blood and therefore oxygen going into some organs, the body shuts down those non-critical functions. For example, digestion and critical thinking. And because the body responds as I've just described, this triggers further danger signals to the brain and a further stress hormone release. And this makes your heart beat even faster, and the whole cycle starts all over again. This It's called the fight and flight response, and it's a normal response, and it's an absolutely brilliant mechanism to help us escape physical danger. But it's also occurring during difficult and sometimes after traumatic events, which is why PTSS, the symptoms, are considered a normal reaction and not a mental illness. And therefore, it's not surprising that when we can feel our heart beating faster, when we're stressed, or we notice that we're breathing very fast, which can make us feel lightheaded, sick, or as though something bad's about to happen, and that then people who are stressed in this way cannot think straight. All these responses are produced by a healthy body and a healthy mind. And it's therefore crucial that we become aware when we experience a fight or flight response that this is normal so that we can intervene.
Juliane, is there something special about PTSS during this pandemic? I kind of think there is.
Absolutely. There is something really different about the current situation because we're all going through similar experiences at the same time. And therefore, we're all experiencing similar symptoms at the same time because we all have the same trigger, and that's the pandemic. So rather than one person experiencing PTSS, for example, after a car accident, or when your dog dies, or somebody loses a handbag, you might have family or friends to support you on that day because they're not going through a tough experience themselves. At the moment, however, we are all going through distressing times at the same time, and therefore it's harder to support one another when we're all feeling unbalanced. And this kind of gives a new meaning to we're all in this together because we're really all unbalanced at the same time. So personally, I think kindness and forgiveness are more important now than they've ever been. We need to learn to recognize feelings of anxiety, anger, and depression and recognize them as normal, because all of us worldwide are currently feeling more anxious and uncertain due to the lack of safety.
Well said. You know, at the end of the day, empathy always wins out. Now,
Yeah.
let's talk about how to treat PTSS. Interesting. I would not have thought about how to treat symptoms. I would have thought about how to treat the disease. But let's talk about that. This is an interesting approach to me.
It is, because it gives the power back to each one of us to learn how to manage and break the vicious cycle of the fight or flight response. We all need to slow down. If we don't need to slow down our primitive brain response, it will lead to irrational decisions and bizarre behavior. It will also ultimately compromise our immune system as stress hormones damage our brain and our body over time. Since post-traumatic stress symptoms is not a mental disorder, treatment is usually not required, as the symptoms will likely improve on their own within a month. However, anyone feeling troubled by their symptoms should talk to their healthcare provider. For example, if it's interfering with work or school, relationships, or if someone is engaging in reckless behavior such as drinking or using drugs to cope with symptoms. There are lots and lots of self-help tools, and we can go through some of those now if you like.
Yes, please, let's do that.
Great. So I want to take us through 6 essential self-care steps. The first one is practice slow belly breathing. Try breathing in through your nose from your belly for 4 seconds. Hold it for 1 second and breathe out for 5 seconds through your mouth. Can we just do that together for 1 cycle? So in through your nose for 4 seconds, hold for 1 second, out through your mouth for 5 seconds. If you repeat this for a couple of minutes, multiple times a day, it slows down your breathing even after you have finished the exercise and you return to normal breathing. It also slows down your pulse rate, and you feel better as soon as you finish the exercise. It's free and you can do it literally anywhere. So that's tip number 1. Tip number 2 is keep as much social contact as possible. This is especially important during times of pandemic and physical distancing and isolation. We live in such a well-connected world. We all have different tools, and now is the time to use them. Research has shown that good social attachments reduce the stress response. My third tip is manage your information exposure. Try to keep accurately informed by reputable news sources while limiting constant watching of social media and what I would call breaking news feeds. Research has shown that following the events on September the 11th in 2001, people who were glued to their television sets watching the towers come down over and over again had far more subsequent post-traumatic stress disorder than those who kept well informed but limited their exposure to those images. By managing our information environment mindfully, we can reduce our emotional reactivity and help to reduce the anxiety contagion in ourselves, but also in others. Tip number 4, stay physically active. At a safe distance, of course, and whilst many exercise facilities are currently closed around the world, we can all keep exercise going in our own living spaces or in an open outdoor area that is safe. Exercise helps to lessen anxiety, anger, depression, and in the long term, it strengthens our immune system. If you're feeling ill, even with a common cold, intense exercise is clearly not recommended. However, mild exercise, such as going for a walk, might still be really helpful. Tip number 5, maintain a sense of purpose and lean into your spirituality. This becomes even more important during times of crisis. Even as houses of worship are closed around the globe, maintain your own practices. Research indicates that having a larger perspective on life helps us cope at times of high stress and of intense threat. And finally, tip number 6, manage your personal boundaries. For many of us, our personal boundaries have become smaller and our freedom of movement has become restricted as social distancing is practiced and travel is curtailed. It doesn't help to dwell on what activities we currently can't do. Rather, we need to bring our boundaries in closer and control what we can control. Depending on your personal circumstances or your living arrangements, try to focus on activities or tasks that you can do, however small. For example, if you enjoy reading in solitude, but you live in a crowded apartment, get up 5 minutes before everybody else. And if you have a balcony, go out and read your book. Watch the sunrise. Do what makes you happy. These small victories of intentional activity and completed task allow us to feel a sense of control and of agency, which can reduce our emotional reactivity.
Juliane, beyond these 6 tips, is there a bonus tip perhaps?
Well, there is something called adaptive engagement. Psychologists have found that those people who practice adaptive engagement fare much better in distressing situations. For example, if you always stop for coffee on your way to work to catch up with your colleagues, and that's suddenly gone, you're missing a big social part of your day. You can't replace it as such, but you can do something else instead, and that's the next best thing. Meet up every morning for a virtual coffee. Make time to have a chat and have a good laugh. In other words, we are remaining flexible to changing conditions around us, and we're leaning into what we can do, what we can control, and this allows us to remain resilient.
Juliane, I have to thank you. I feel much better prepared to deal with stress now. I always was pretty good at it, I must say, given my police training, but these are things I never really considered. I always was thinking you had to tip into being diagnosed with PTSD in order to start getting better, but let's cut it off before we get there by dealing with the actual symptoms.
Absolutely.
It's absolutely brilliant. Now, let's tell everybody about post-traumatic stress disorder and why that is a clinical condition and it is different than the symptoms themselves.
So PTSD is a clinical condition, and the symptoms develop during the first months after the traumatic event and not immediately after the event, as I described for PTSS. So anyone who's experienced or witnessed a situation that involves the possibility of death or serious injury, or who learns that a close family member or friend has been experiencing such an event, can develop post-traumatic stress disorder. It's not completely understood why some people who are exposed to a traumatic situation develop this disorder whilst the majority don't. In a small number of cases, there may be a delay of months or even years before symptoms start to appear. This is common, sadly, in all types of abuse. Some people with PTSD experience long periods when their symptoms are less noticeable, followed by periods where they get worse. In other words, some people have constant severe symptoms, whereas some people with this diagnosis are hardly affected at all.
Juliane, you've given us a lot of good information about PTSS and PTSD. Could you summarize the key points for us?
Yes, of course. PTSS symptoms are common after military or humanitarian deployment and may improve or resolve within a month. PTSD symptoms are more severe, persistent, and can interfere with daily functioning and can last for more than a month. The second point is that most people with PTSS do not develop PTSD. You can develop PTSD without first having PTSS. My third and penultimate point is that PTSS requires no medical intervention unless symptoms are severe. However, you will certainly benefit from psychological support and occasionally from healthcare support to prevent the symptoms from worsening. But self-help is the key here. And my final point is that PTSD is a medically diagnosed condition and should be treated by a clinician.
My guest has been Juliane Kause. She's the Chief Medical Officer and Medical Director of the Anvil Group. We've been speaking about PTSD and PTSS in 2020. Ms. Juliane, thanks so much for coming on the show. This has been really, really insightful. I've learned a lot. What are some of your closing thoughts here? Bring it home for us.
So first of all, thank you for inviting me and thank you for speaking with me. The most important point I'd like to leave you with is there's help out there if you need it, and I provided some contact details. Help can also be your family, your friends, not just clinicians. And secondly, I'd really like to say to everybody who's watching this conversation, hang in there. This pandemic will pass.